The Asian Pacific American Network of Oregon asks, what's your healthcare story? APANO asked a group of Asian and Pacific Islander community members.
My name is Jennifer.
My name is David.
My name is Anselmo.
I'm Andrea. My name is Madeleine.
Questions about their unique and diverse experiences in accessing healthcare to better understand what works and what doesn't work to keep our communities healthy. APANO asks, has costs affected the ability to access healthcare for you and your family?
There have been times where cost is a problem and cost hasn't been a problem. With us kids, there's about like 6 of us, and when it came to my little sister falling out of a window, she had to go to the doctor. Good thing that we had insurance, so that covered a lot of the expenses of the ambulance, her treatment, and all of the hospital bills. But then when it came to like things that weren't covered by insurance, like that became a problem, because then it was like that put stress on our parents how to get money to pay for these expenses while still trying to provide for the family. So that was like one problem that I saw. And then along with just as not being a barrier would be the resources that they found that help them pay for like accessing insurance or accessing healthcare. Like my dad is a veteran, so he got a lot of help from his Social Security from the VA hospital down in White City and in Roseburg that like lifted a burden off of the family as well. So that was pretty good.
I think in my family growing up as a kid, I didn't really know how much my family had to sort of scrape together to pay for some things and how difficult that was, because I think my mom really kept a lot of that information from me to not have to overshare some of the financial burdens that she had to carry sometimes all by herself. But I do know that as an adult, when I was serving in AmeriCorps, we were earning wages that were at poverty level. That's the point of sometimes AmeriCorps stipends, is that they want us to be at the level that of the community that we were serving. And at that time, I was in Massachusetts, and Massachusetts as a Commonwealth does have almost like a universal healthcare system where anyone who cannot afford will be able to access healthcare for next to nothing. I think I didn't really pay for any of my healthcare, but I think just to go into a free clinic, to fill out those paperwork, to ask for help from my government, it was really hard for me. It was a really shameful thing for me to say that I can't afford it. And I think I don't know how much of this is really specific to my culture. I'm sure a lot of people experience this sort of shame, but I think that I think that there's that, even when we are receiving benefits and services from the government, there's a lot of shame of doing that and not wanting to ask for help and not wanting to ask for aid in terms of funding, because it's just not something that we are sort of taught to do growing up. Growing up, I just remember a lot of my high school friends have to think about their whole family and having to think about what they're going to do as a career that will support their whole family, like grandparents down to their little cousins, right? But I do know that cost to healthcare is not just unique to our community. And I had a friend just a couple of weekends ago. He was just feeling really, really sick, and he doesn't have health insurance. And he's, after graduating from undergrad, he doesn't have a job right now. And I feel like that's a phenomenon that's pretty unique to this generation of young people, is that we graduate with a bachelor's degree, we can't find a job that provides us with healthcare. Most of the time we can't even find a job. And so I think that is frustrating, sitting with him feeling terrible And instead of being like, what's more important to my health, it's like, what's more important to my financial capabilities of paying for this? Should I go to the emergency room or not? And just have to sit there with someone to make that decision because of the lack of funding is really frustrating. And yeah, and I think that even though when I got out of college, I was able to find a position that had health care, it was still really minimal. So right now, you know, there's also such a credit card generation that although I was like racking my brains thinking about cost as a barrier, I'm like forgetting the fact that I have $2,000 in debt on my credit card because of healthcare coverages that I have to pay for myself. But I just like don't think about it because it's on my credit card, I'll pay for it eventually. But it is because of healthcare that my health insurance didn't cover. And it is, you know, it's a negative net worth.
Looking back at my experience in my childhood, my mom worked at home, commonly referred to as a stay-at-home mom. My dad worked in the restaurant industry. There was no health insurance at all. And our view of going to the doctor was it better be pretty painful if you went to there was no preventative at all. My parents never ever went to the dentist, except when I was probably about 5th grade, almost at the same time. They had all of their teeth removed because they were just in such bad shape, their teeth. And so I'm not sure how they paid for it. I know we didn't have health insurance, but my brother and I were able to go to the dentist for regular checkups and that. And I remember as a kid witnessing my parents losing their teeth. I said, that's my goal. I want to die with my own teeth, you know. I remember my mom, when she first got her set off, I can hear it to this day, the food just doesn't taste the same. So it just really stuck to me, you know. But anyway, that's as a child. But again, now as someone part of the system with good health care and so on, I still worry about it. The part that I'm worrying, I mentioned earlier, my son's brain tumor. He was getting MRIs 2 or 3 times a year, a cost of almost $4,000 a piece. The insurance luckily pays the majority of that. However, at age 26, he will be off of our insurance, and he's not working right now. So I'm just looking, sort of like, you know, you were sharing. I'm just, wow, how are we going to deal with that? Because we're going to pull out all the stops. Meaning, I'm not going to not get get the proper care for him because we don't. So we have to figure that piece out. Probably like most families, we don't have an extra $4,000 sitting around for an MRI. So how do you make that happen? So that's a worry. We're caught right now. We're on my wife's medical insurance. She is hoping to retire sometime soon. And so if she were to do that, all of us would be without health insurance unless we bought it supplementary, or, and I think some of you might know, this is why I'm in pursuit of full-time work. I left full-time work about 5-6 years ago for a whole different set of reasons. So since that time, we've been on my wife's health insurance. So now I'm in pursuit of full-time work to basically just to get those benefits. And so that's always been a worry for the last couple of years, because I know my wife, Rosemary, she's at the point in her career where she literally needs to retire, I think, for many of the same reasons that we talked earlier. She has a huge heart, has been giving a lot, so she needs to pull back a little bit and take care of herself. And I was talking to Gennie at the break, where do you find the time to do that? Well, if you retire from work, you can do that. You can still have the huge heart for the community, you can exercise, you can read, play the guitar. So in my way of thinking, take away the work piece. And so that's where we are at right now as a family with this whole healthcare issue, how to make that happen.
I guess, yeah, I took it for granted too, the fact that you get health care, you can go to the doctor and get, you know, eye doctor, dentist, what else, you know, any kind of doctor. And so some of my friends in high school, or one of my friends in high school, her dad got cancer her senior year, and I guess at the time she had thought at the same thing, healthcare is taken for granted, and her parents didn't have, or they had stopped it because they could no longer afford it. So for her, It was really hard. It's sad. It's sad. Where people, I think, some people pay a lot for their health care, and so they can get a lot of stuff kind of for free, as simple as like a dental checkup, where other people, it's like a life-threatening disease and they can't do anything about it. Yeah. It's kind of unfair. Yeah.